અમે વિદેશમાં વસીએ પણ દિલ અમારું ગુજરાતી. અમે ભલે કોઈ પણ કારણથી વિદેશમાં રહેવા લાગ્યા હોય પણ અમારું હૈયું તો ગુજરાતમાં જ છે. અમારા દિલમાં તો ગુજરાતના જ ધબકારા સંભળાય છે. અમારો નાસ્તો ગુજરાતી, અમારું ભોજન ગુજરાતી, અમારું ખાનપાન ગુજરાતી, અમારી રહેણી કરણી ગુજરાતી. અમે ઘરમાં પણ ગુજરાતી બોલીએ અને બધા જ તહેવારો ઉજવીએ. જ્યારથી રેડિયો સાબરમતી 89.6 FM સાંભળવાનું શરૂ કર્યું છે ત્યારથી તો એવું લાગે છે કે અમે ગુજરાતમાં જ બેઠા છીએ. અમારા જેવા NRIની આવી રસપ્રદ વાર્તાઓ તમને સાંભળવી જરૂર ગમશે. તો ચાલો આપણે બધા સાંભળીએ સાત સમુંદર પાર રેડિયો સાબરમતી 89.6 FM પર દર સોમવારે સવારે 11 થી 12. આજે જ એન્ડ્રોઈડ એપ ડાઉનલોડ કરો અથવા ઓનલાઈન સાંભળો રેડિયો સાબરમતી 89.6 FM. ખુશ રહો, આબાદ રહો.
Hello and a very warm welcome to our very special program on Saat Samandar Par, only on Radio Sabarmati 89.6 FM. Our today's topic is on health and humanity. Friends, in today's fast-changing world, medical science has made incredible advancements. Yet, a large section of society still struggles to access even the most basic healthcare services. Many people seek medical help only when illness becomes severe, often due to lack of awareness, affordability, or access. This reality highlights a crucial truth. Healthcare should not begin in hospitals but in our daily lives through prevention, education, and early care. In this direction, we are honored to feature an inspiring initiative led by Dr. Tushar Patel from New Jersey, USA, who is taking a meaningful step towards opening a non-profit preventive care clinic. His vision is rooted in compassion to underserved communities by providing accessible screenings, health awareness, and guidance for a healthier life. And to bring this important conversation to you, we are privileged to have our very special host, Mr. Tarun Soin, joining us from California, USA. He will be leading this insightful interview and helping us understand how such initiatives can create real impact in our society. So stay with us as we explore how preventive care, compassion, and collective effort can build a healthier and more equitable world. Stay tuned.
Hello, I'm Dr. Binny Chauhan, mind trainer and holistic health coach from Ahmedabad. Many congratulations and loads of good wishes to whole Radio Sabarmati team. You are listening Radio Sabarmati 89.6 FM. Khush raho, abad raho.
Thank you so much, Kiranji, for wonderful introduction and setting up the theme and agenda for this podcast. Hello audiences, my name is Tarun. आप सबको मेरा प्यार भरा नमस्कार. So today we have a very distinguished personality among us. So I'm going to be interviewing Dr. Tushar Patel. He is a medical professional and he is working for community service for last 27 years and he has a wonderful, interesting work he has been doing for so many years. So we are going to be talking about him. So let me start by asking Dr. Tushar. Welcome, Dr. Tushar. Can you give us a brief introduction so that people will have some idea?
Thank you so much, Tarunji. Thank you so much, Kiranji, and Radio Sabarmati for this wonderful opportunity. This is my third time on this radio, and I'm so happy that I'm able to highlight my organization. So let me start introducing myself. I work for federal government, Federal Bureau of Prisons for last 27 years. Retired in 2020 after my full service with the federal government. And I have been involved with the community organizations in New Jersey. And one such organization is Health Camp of New Jersey, where I am the president since 2013. And I have been helping this organization to bring to a next level. We have been conducting the health screenings in New Jersey 6 to 7 times per year. As of right now, we screen more than 15,000 individuals, diagnosed close to 4,500 chronic disease abnormalities. And now the next question is, what is after that? When we diagnose something, what would you do? So the next step is we will be talking about today.
Thank you so much for your introduction, Dr. Tushar. So as the audiences you just heard, so he has been from medical background for federal government United States for almost 27 years. And he's such a wonderful soul, and that for last 6 years now, since 2020, he retired, and he's serving the community, especially Indian diaspora in US, especially in New Jersey. And he's running health camps for so many decades and helping so many people fill their medical needs. So we will talk about more about his organization, how he has achieved all this, and how he's planning to expand this effort, helping more and more people. But let's just get some background first so that everybody is on the same page, they understand, and especially for people who are in India and would like to travel and visit their relatives here. So there are a lot of misconceptions and there's a lot of confusion and ignorance about the different systems here, medical system as against the India. So Dr. Tushar, let's start with comparing Indian healthcare system with the US healthcare system. How is this different from somebody, like say, coming from, let's say, Gujarat or Delhi or anywhere from India, traveling here for the first time and maybe visiting their son or daughter or any other relative? What do they need to know? How this system works here as compared to Indian system?
A very, very good question, Tarunji. The system in India is totally different than United States. US has a very good healthcare system. However, it is very, very complex. So for common people who comes from India without any kind of insurance or healthcare benefits, it is very, very difficult for them to get the basic screening done here. If they go to doctor's office, they have to pay out-of-pocket expense, $100, $200, whatever the case may be. So the system is totally different. When you are in India, you can go to any physician or private hospital or a government hospital. You get the appointment right away and you can pay out-of-pocket expense. Nowadays, they have insurance systems as well. So Mediclaim or many other government benefits they also have in India nowadays. Or those people who works for the government system, state government or central government, they do have all the benefits of medical as well. So things compared to India and here, if you don't have an insurance, you are lost here in the United States. You need to have some kind of basic coverage. It's called Affordable Care Act, which also called Obamacare. So for that also, you need to have some kind of eligibility. So if you are on a visitor's visa, you have no chance of getting those kind of insurance. You have to find a private insurance, which is very, very expensive. So my advice for the parents or the individuals who come from India is to get some kind of visitors insurance coverage that will cover your urgent and emergency medical care. So you don't end up in bills for thousands and thousands of dollars for your children or for your parents or whatever the case may be. So first thing, if you are on a visitor's visa, you must come with some kind of insurance which covers your urgent and emergency care. If you have to go see a doctor for high blood pressure or diabetes or some regular visits, you don't need that insurance, but it's very good to have during emergency situation, which will cover your emergency care.
That's wonderful. So basically, this is we all have heard a lot of horror stories and some anecdotal evidences saying that, some so-and-so came and I think they had such a hard time. Because the healthcare is very expensive here, but if you don't have insurance, then it's definitely you have to feel the whole brunt of that, the cost. And it's not like India where you can go to any street doctor, right? So that's very important point that they have to have some insurance. So that is a backstop. At the worst case, they will be covered, right?
Yes.
So what are the main issues? I think so. Let's say somebody is a student, like he's just coming at the first time, or you are a low income person, or you're a retiree, or you are just visiting like from India. So what are the barriers or issues they're going to be encountering here? So they're like, even the visitor insurance, they don't cover the existing conditions, right? So what are the challenges or issues you see people facing? They have to be aware of that.
So if the students are coming here in the United States, depending on the state, states have a lot of benefits for the students. They can apply for, like in New Jersey, we have called NJ Family Care, where they can apply, the family can apply depending on their income level. So the state government covers those expenses for the regular doctor's visits or immunizations or whatever the disease they may are going through. Once a year physical examinations, all those things are covered by the New Jersey State Medical Family Care. Similar kind of programs are available in all the states. For those parents who are coming on a green card, and if their age is 65 and over, and if something happens to him and they end up in a hospital, there is a program called Alien Medicare. Alien Medicare covers the in-hospital bills for that individual as long as they have green card. They don't have to be a citizen. If they are citizen, they may be able to get other benefits of Medicare if they are 65 and older, or Medicaid if they work in the United States or their income is low. So this US healthcare system is so complex. And I think South Asian, especially Indians, they don't have basic understanding how to get those benefits.
That's so important, I think, for like elaborating that steps that, okay, if you are like have green card and citizenship, that at least you have some coverage and you are like basically covered by government and other federal government programs. But if you are individual coming like a first time traveling and seeing your daughter or son, then you need to be very careful and you have to have medical coverage.
Absolutely, absolutely.
So, Dr. Tushar, so in general, what is the issues you see like Southeast Asian community? What kind of medical problems or challenges and issues generally you see mostly in our community? I know we are genetically predisposed to have heart disease, diabetes, and stuff like that, which are kind of like specific to our community. And we also believe in very holistic, which is good, Ayurveda, yoga, and a lot of other nice, good stuff like a nice lifestyle, other based treatments. But despite that, we have a pandemic of all these chronic conditions. So what you have seen, like what kind of taboos or what kind of issues or what kind of prevalent misconceptions are there in our community? If you can just address those.
Yeah. So preventive care is the key factor in a good overall outcome of the health. In our population, South Asian, especially Indian, we don't get the timely checkup. So once a year physical examination is a must. You need to have preventive care screening done at age 50, at 45, at 60. So all those things for the last 27 during the health fair, we see chronic disease such as diabetes, hypertension, cardiovascular disease, mental health is huge, as well as cholesterol issues. Every time when we see the blood test report comes from the health camp, we do see many abnormalities of those diseases. So I think most of the reason because they usually don't get a periodic check done. So periodic checkup once a year, twice a year, whatever is recommended is required for better outcome of the healthcare of that individual. So if you don't get a cholesterol check every 2 years or every 1 year, depending on your numbers, you definitely will end up in more complicated cases later on. My advice is to get the periodic screening done and once a year a physical examination by your physician.
That's, I think, a very important point you highlighting that. So our background, especially in India, we think that going to a doctor's office or like to seeing somebody in the medical profession, that shows there's a problem. There is some issue. There's something wrong with us, right? I'm not talking about the mental health. I mean, mental health is a big stigma anyway, but even for the physical health, right? Going to get a cholesterol exam done, or maybe even just going for the dental cleaning. We pretend that, okay, there's some problem that we don't need to see if we are healthy and we're doing right things. So that's a very important point you brought up, that the cholesterol and blood pressure and the sugar, those things, these are like silent killers, right? They don't even like show up on anything, right? We don't even realize that. But a lot of people, I think, silently suffers with that. So that's a wonderful point that you raised, that we are not aware of this issues and we think that going to a doctor's office is like if we are sick or something. That is not the case, what you're saying, right? It is
absolutely. Prevention is the best cure, because if you diagnose something early, even a diabetes earlier, I think your chances of getting less complications are very, very high. And I think you end up in complicated cases is very less. So if you have that early disease diagnosis, and prevention is the best cure.
Wonderful, wonderful. So I think that brings up the next part. So there's a mentality. We kind of feel like, okay, medical system is kind of geared up to make money, or just kind of, it's not considered like a part of a healthy lifestyle that you go and get checked up and kind of make sure that everything is doing, like you just go for maintenance of your car, right? You go and oil change and all that, but you don't feel like going to doctor's office to get this normal things to be taken care, right? So that brings up the question. So we have that aspect, mentality, our Indian community, and then the insurance, I think they charge money. There's a cost. These things cost a lot of money, right? So how did you get inspired to start these camps? So that seems like a wonderful place where I think people can get without any charges for free. They can get a window into their health, right? And you help people find early detection. So can you elaborate more? How do you get this idea and how do you see this coming in?
Dear friends, before we continue this insightful conversation, let's take a little break and listen to a beautiful song sung by our today's guest speaker, Dr. Tushar Patel.
मधुबन खुशबू देता है, सागर सावन देता है, जीना उसका जीना है, जो औरों को जीवन देता है, मधुबन खुशबू देता है। सूरज ना बन पाए तो बन के दीपक जलता चल, सूरज ना बन पाए तो बन के दीपक जलता चल, फूल मिले या सच की राहों पे चलता चल, सच की राहों पे चलता चल, प्यार दिलों को देता है, अश्कों को दामन देता है, जीना उसका जीना है, जो औरों को जीवन देता है, मधुबन खुशबू देता है, सागर सावन देता है, मधुबन खुशबू देता है। चलती है लहरा के पवन के सांस सभी की चलती रहे, चलती है लहरा के पवन के सांस सभी की चलती रहे। लोगों ने त्याग दिए जीवन के प्रीत दिलों में पलती रहे, के प्रीत दिलों में पलती रहे। दिल वो दिल है जो औरों को अपनी धड़कन देता है, जीना उसका जीना है, जो औरों को जीवन देता है, मधुबन खुशबू देता है, सागर सावन देता है, मधुबन खुशबू देता है।
Thank you, Dr. Patel. It was truly wonderful. Welcome back.
So in 1998, a group of physicians, some healthcare professionals, community leaders came together and felt that we could make a difference by offering free health camps, because at that time, baby boomers, a lot of parents were coming here and they did not have any insurance, and they were putting off getting the regular checkups done, and they were just waiting for the illness to happen. So first few camps, we identified that these individuals definitely need some kind of periodic screening, at least once a year, a basic physical exam, a blood test, EKG, and a cardiology evaluation done. So over the time, this initiative grew into a trusted community effort that served thousands and thousands of individuals in New Jersey. And like I mentioned, the number 15,000. And after we started, so many other organizations also doing this kind of on a smaller scale, but to helping our community. So that's a good thing, that even if you diagnose one individual, one abnormality is worth effort. And like I can tell you that we have diagnosed breast cancer, cervical cancer, prostate cancer, you name all different kind of cancer, and we intervened earlier. In some cases, we even spend money for those individuals to provide them care. And I think we have a good story to tell, that we have identified those individuals, intervened, and I think they are having a very healthier life right now.
That is so amazing to hear such stories, and some cases where you actually save somebody's life based on just this kind of casual walk-in camp.
Yes.
In a right. So
Yes.
that's such a wonderful feeling as a doctor. Since you retire early, my understanding is that you retire quite early, and you've been dedicating your life to health of our community and bringing up all this medical profession, all the professionals, and serving this community. So how did you get to organize this? I mean, what is the mechanism of this organization? So you go and reach out to like a public place, like a temple, some different organization, and then how you logistically deal with such a challenging, like bringing all these professions together and all this, like all the facilities together, and then you need an army of volunteers to actually help out in setting up such camps, right? Running and doing lab tests and all that.
Yes.
So can you discuss a little bit more about that?
Yes. So initially, back in 1990s and early 2000, we did not have too much electronic stuff available like Facebook or emails or those things. So at that time, we used to put the advertisement in the local newspapers, in the magazines. Now in this 21st century, after 2010, 2015, we are doing electronic email to sending it to our volunteers. They come volunteer their surveys. We have Facebook page, we have Instagram page. So electronic communication is there now. And our website, www.ihcnj.org, has electronic registration for patients to fill out the form, which we gather all the information for them. And it's a pretty seamless process now compared to what we used to do, all the paper application. They used to mail it to us. We used to enter in the computer. So now with all the advancement, and we have very professional, dedicated volunteers, student volunteers, some CPAs, some accountants, you name it, engineers. We have a group of volunteers in our organization. They come every time when we do the health camp. So besides our medical professionals, doctors and nurses and nurse practitioners, we have other professionals as well coming out and help. And for the last, I would say 10 years, we have developed a program for the student volunteers. Those who are inspired to go to a medical school or nursing school, they get a free volunteering hours and they get hands-on experience with the doctors.
Oh, that's so wonderful. I think, yeah. So it's definitely very important to engage the young generation who especially wants to go into the medical field to kind of just to volunteer and donate and their time and effort and be part of the community health. So, Doctor, now I noticed that you have been running camp for so many decades now. So now you are into another ambitious project of actually doing a health center, right? So can you talk about a little bit more on that? And
Yes, I'm very excited to announce that this will be the first ever community health center focusing toward the South Asians, especially our Indian population. We did some research and there is no such a kind of health center in anywhere in the USA. So we are the first one. So in 2023, Health Camp of New Jersey celebrated 25th anniversary event. At that time, just out of the blue, we had this idea of community health center, but we had no idea how much work it involves. But we announced it that we are ready to open up a community health center by 2026. And with God's grace, community support, and our strong executive committee and board of directors and our volunteers, we are ready to open up a community health center. And it's an outpatient community health center. It will be Monday to Friday, just like a primary care clinic for medical, dental, mental health, and eye issues. So it's going to be a full-time Monday to Friday where we will be hiring a physician, hiring a nurse practitioner, office staff, and it will be like a regular clinic. Patient can come. If they have Medicare, Medicaid, we should be able to accept that. If they don't have any insurance and if they fall into the federal poverty guideline, we can have the sliding fee scale for them, $10, $20, $30 based on their income. But no one will be denied basic care. So if they come for their hypertension, diabetes, cardiovascular disease, we will make sure they will be seen and they will get the medication. We'll have a contract with the pharmacy. We'll have a contract with other local hospital as well. So if we need to refer someone there for any urgent or emergency care, we are covered.
So this sounds like almost too good to be true. I mean, basically what you're saying is you're providing a full-fledged outpatient services. So it's like full medical services in a setting where you don't really care if somebody has insurance, they don't have insurance. You're going to accommodate all kind of people from every walks of life, every community. It's not just specific to North Indian, Southeast Asian only. And so then this almost looks like a panacea for like all the problems in US about the healthcare. How are you going to achieve? Because this is going to take a lot of logistical, it's a bureaucratic, you have to deal with the bureaucracy and one side, right? All the insurance companies and I think whatever they have insurance. And then you have to bring all these medical professionals together. And then it is so low cost or almost free for like people who need help. How are you going to manage that? So can you talk a little bit more about the financing side or how the logistically it is going to work?
So for the last 3 years, we have been doing a lot of research. My about 60-70% of time for the last 3 years have been going in this project. We are so lucky with our board of directors, our supporters who have been also helping in this project. And very happy to announce that there is a business entrepreneur in New Jersey. His name is Lata and Atul Shah. They are very dear friend to our community. After seeing our proposal, without anything asked to them, they donated $1 million over 1 year.
Wow.
So we already got the first check of $250,000 from them this year in March. They will be giving periodic checks every 3 months. So I think that will definitely cover our expenses for next couple of years. But the good news is we are in the process also of applying for the federally qualified health center or look-alike clinic. So look-alike clinic will be happening this year in 2026. That means we are approved by the Medicaid to get the grants. But when we get the federally qualified health center status, we will be getting the money from the government on a regular basis without even applying. So our goal is within next 2 years, get the federally qualified health status called FQHC. If we get the FQHC, we get the money from the government on a regular basis. That will allow us to sustain this program for a long, long time. We'll keep the legacy going for forever.
That's so amazing to hear that. So the doctor, that brings up the question. So is that the amount of funding you expecting to get from federal government? Is that going to like constrain or limit in any way? Like you only can see this many patients or this much? I'm guessing because this is like such a expensive thing in healthcare in US, right? And so somebody's saying that okay, they're going to see the doctor and see all the treatment they can get here. So I'm sure there will be like a flood of people who wants to come and get this avail this facility because there are so many people who needs this thing, right, in community.
So yeah, FQHC, federal government wants more and more people to go in this kind of clinics because that will limit emergency care visit for them. They will save money. So I'm going to give you one statistics right here. In 2024, more than 34 million people used Health Resource Service Administration funded healthcare in the United States, 32.4 million. That means 1 in 8 children, 25.1 million uninsured Medicaid, Medicare patients, 1 in 5 rural residents, more than 1 in 15 over 65 years of age, and almost 500,000 veterans use these services. So I think government wants more and more such a program. I think our population, and very sad to say that we are not connected with the real world. And I think we all, the physicians, the non-physicians, the community leaders, all needs to get involved in this kind of project. We should have in New Jersey about 20 centers like this. We don't have to wait because New Jersey is a highly populated South Asians, especially Indian population. Same thing, California, Illinois, Texas. All those states should be taking this initiative and open up a community health center for our population.
So that is like, you bring a very interesting point. So you're saying that the federal government is very happy to give money to this kind of organizations because ultimately it saves money to the taxpayer, right? And
Yes.
so many people, instead of going to actual emergency in the hospital and paying like hundreds of $1,000s for a treatment that time in an emergency situation. So what is the reason? I mean, why you think is that it's not popping up? Like they're not, so why they're not 20 in there? I'm in California, I'm in Bay Area. So I'm not aware of any. I mean, there may be some, but at least I'm not aware for the Southeast Asian. Or there could be some I'm not aware now. So what is the reason? Is this a logistical nightmare to deal with all this thing? Or is it like a profession, like in medical professionals are not willing to jump in? So what do you think is the reason?
Combination of all. Logistical nightmare, a lot of red tapes, a lot of paperwork needs to be done. It's not a money-making business. It's a servicing business. So if you are a typical physician only looking to make money, this will not work for you. So you have to be community-oriented, giving back to the community. And like Lata and Atul Shah is a perfect example of a business entrepreneur who is willing to give money. And I think this is not the end for them. They will continue to help us because they believe in this project. And I think it has to come from your heart. A lot of work, but I think at some point in life, you have to keep the legacy going for our population. I'm not going to be here forever, and no one else is going to be here. So I think we need to pass the torch to our younger generation, such kind of things, so they can carry forward for our population.
I think you put the finger on the pulse. I think you basically very rightly said that these endeavors, they're so noble and they're so helpful for people around us. But at the end of the day, I think they require volunteering. They require like warmth in your heart. and a desire to help beyond yourself, right? Instead of just kind of making money, just like any doctors or whatever surgeons they make, or just fame. I think, of course, I'm not denying that they have their heart is the right place, but they have to go beyond that and
Yes.
think, right? That's, I think, the main.
Everybody needs to make money, but at certain point, I think, like religion said, you have to give back 20%. So if you can turn man and dhan. So if you cannot do it with turn and man, you can do with donation. If you cannot do with donation, you can do at least give your time. So the challenge is open to everyone that, hey, if you don't have money, come and give your time as a volunteer. And I'm so happy to announce one thing, that the community I am in, I am so fortunate that the community support has been outstanding, from the physicians, from the healthcare professionals, from the volunteers, our doctors, nurses, pharmacists, students, community members. They donate so much time to our health camps, and we are looking forward for the same kind of support when you open up the healthcare center. And not only the individuals, but the community organizations such as the hospitals, the labs, other organizations where they provide this kind of services, they all come together to give their time. So I'm so happy that the community is very tight here in New Jersey.
Thank you, Tarunji, for leading a very informative discussion. Let's take a quick break and listen to another beautiful song by Dr. Tushar Patel.
जाने कहाँ गए वो दिन, कहते थे तेरी राह में नजरों को हम बिछाएंगे। जाने कहाँ गए वो दिन, कहते थे तेरी राह में नजरों को हम बिछाएंगे। चाहे कहीं भी तुम रहो, चाहेंगे तुमको उम्र भर, तुमको न भूल पाएंगे। मेरे कदम जहाँ पड़े, सजदे किए थे यार ने। मेरे कदम जहाँ पड़े, सजदे किए थे यार ने। मुझको रुला रुला दिया जाती हुई बहार ने। जाने कहाँ गए वो दिन, कहते थे तेरी राह में नजरों को हम बिछाएंगे। चाहे कहीं भी तुम रहो, चाहेंगे तुमको उम्र भर, तुमको न भूल पाएंगे। अपनी नजर में आजकल दिन भी अंधेरी रात है। कहाँ गए वो दिन कहते थे तेरी राह में नजरों को हम बिछाएंगे चाहे कहीं भी तुम रहो चाहेंगे तुमको उम्र भर तुमको न भूल पाएंगे तुमको न भूल पाएंगे तुमको न भूल पाएंगे.
Thank you, Dr. Tushar. That was fun. Welcome back.
So, I mean, that's a very interesting point that you raised. I think so. People, I think mostly everybody has a goodness in their heart and they all want to help. It's just kind of a catalyst needs to be there. I think somebody like you, in this case, you are the one driving this thing, right? Along with some other like board members and other like people, like you mentioned, the donors, right? So
Yes.
it's just there. I mean, the desire is there and the need is there, and it's just a matter of bringing together people and kind of just to make that soup. I think you have to bring the right ingredient, the right.
Yeah, sometimes is guiding and leading is more important, because I think if you lead the right way, people definitely come and help.
Yeah.
This is what I experienced in my government services as well. I had some good leaders. That is the whole reason I am able to lead this organization. And I think my experience with federal government also helped me getting the other side of what can happen. So
one thing, doctor, I think we did not talk about. Just wanted to just bring that up also. So this is this outpatient center you're opening. That is not just the physical health. I think the mental health is also important component of our overall holistic health. So are you addressing that also? Will that be addressed? And there's a lot of taboos about in Indian community. Would you like to say something? And
yes. So let me tell you, for our health camps, when we do health camps periodic 5-6 times a year, we do have mental health component in there. We have an organization called SAMIN, South Asian Mental Health Initiative and Networking. They are full-time with us during the health camp. They do mental health screening, evaluation, counseling. They even go 2 steps forward and they even do a follow-up with them. So mental health is a big aspect of our health camps, and we'll continue to provide that in our health center as well. And other services such as immunization or a periodic screening, age-specific screening, all those things will be part of our healthcare center as well.
That's so wonderful to hear. So then my thought is that, I mean, this is so all amazing, such a nice effort you're doing in New Jersey. So I'm being a little bit jealous about New Jersey residents that they are, I think they're going to avail all this facility. So I'm talking about like the people in California, in Texas and Florida, so many other places. So if other wants to follow your example, they want to kind of go on that same route and help out, what would you suggest? Do you have any some general ideas about them, how they can get started on this?
Yes. So first of all, any state wants to open a community health center, they need to figure out or find out the area. Area has to be 90% of this patient had incomes at or below 200% federal poverty line. So when you apply for this kind of programs, Health Resources Service Administration called HRSA or HRSA funded healthcare centers, they look for specific geographic area where they have low-income people resides. That's number one. Number two, if they want anything from me, the lessons we learned, I'm happy to share all the information without any charges. I'm ready to have a call with those individuals, and they can call me at 848-391-0499. My cell phone number is open to everyone. I don't hide anything. I get 200 phone calls every single day from my community. So I'm willing to provide our expertise from our team, how to do it, what are the steps they need to take, what structure they need, all those things we can definitely guide them as long as they have a vision of serving the community. This is not a money-making business. This is definitely a community giving back project.
Wow. So I think You really gave a pitch for such a, I think, it should galvanize people all around the country. I think you're graciously offering all kind of help, logistical support, any expertise or any like a bureaucratic, how to deal with the bureaucratic system and red tape and all that. So, I mean, there's no reason, I mean, people like you there who are, they want to give back to community and they have some background in medical profession, they can definitely help. I mean, there's a
They
huge
don't
demand.
need any medical background to open this. Anyone can open this as long as they have understanding of community giving back. They have support from the local community. We can definitely teach them. We can guide them how to do it. They can definitely, hiring medical staff is not an issue at all. There are so many people looking for this kind of services, and we will be paying those individuals who come work for us. This is not going to be a free service. As a board of directors, we cannot take any penny from this project. However, we can hire individuals to provide the services.
Wow. So the barrier to entry is even low. I mean, the people, if they don't have to have medical background, and they can, I think, yeah, they can just be on the track to set up these things, and they can get all the information they need. Yeah.
Yes,
Yeah.
yes.
So I think we got a lot of details from you from different angles. Anything you think we missed out? I think you want to add, like especially of interest to like Indian diaspora in US or like people planning to visit India from India here.
Yes. My message to people here in the USA as well as in India, or they are coming here from India, preventive screening and regular checkups and the vaccinations are the key for healthy outcome. I'm going to give few examples here. So we should be getting a flu vaccine every year, 6 months older, and everyone else above age 6 months and older should be getting a flu vaccine. They need to get the cervical cancer screening female, cervical cancer screening women every 3 years from age 21 to 30, and every 5 years from age 30 to 65. Cholesterol test or lipid screening regularly as part of your physical examination once a year. Diabetes screening, hemoglobin A1C for your blood sugar. To check your control over 3 months, you should be checked regularly. If you're a diabetic, you should be getting every 3 months. Breast cancer, mammogram, age 40 and 50, and repeat every 1 to 2 years until age 75. Colon cancer screening, that's probably no for our population. They never get colon cancer screening. Starting at age 45 to age 75, and if you have a normal, you can get once every 10 years. Prostate cancer screening during your physical exam at the age of 50 until age 69, including blood tests for PSA. So many other screening you can do, but these are the main screening which will definitely, if you get this diagnosis early, your chances of getting the overall better outcome is better. And I think regardless of religions, sex, or your gender, all those screenings are required. Like getting vaccine, shingles vaccine is very important. There are 2 doses of shingles vaccine, 2 to 6 months apart. After age 50, you should be getting that once in lifetime. Pneumococcal vaccine to avoid pneumonia for the older age. So many people died during COVID and even dies today from COVID as well as influenza because of pneumonia, because they don't get those kind of vaccinations.
So these are such a, important details, Doctor, you're giving. So I'm guessing most of us, like me, who are not from medical background, they may not remember all these details, like which screening to be done, which age. So if they go to regular doctor, I mean, they go to your like health camp, or they go to health center, or they go to the primary care physician, they should follow whatever the doctor says, all the preventive measures, all the preventive tests that should be followed, right? That's kind of that's a very important first step, I think, in trying to kind of
Yes, yeah, absolutely. Unless you have some contraindication for a vaccine or a medications or kind of a screening, you should be getting the advice from your doctor. And this is what we do at the health camps. Because our physicians are so busy during their practice, They don't have time to interact with their patients regarding all the things they need. But health camps, we do have providers who can talk to them one-on-one. They can give those advices and they can go back to their physician if they have physician and get those services. So that is the whole thing about the community screening and the health center and the health camps.
So personally, doctor, I mean, I know a lot of my friends, they are very educated. So there's a prevailing, I think, Indian mentality is that not everybody is kind of on board with medical tests and screening. So there's a lot of misleading info, misconceptions that, like I was saying in the beginning, we talked about, right? So they think they don't have much the faith in allopathic medicine itself. So that is the fundamental, I think, the root of the problem is that they get a WhatsApp forward. If you drink this water, or do this leaves, or do that nuska, gharilu nuska, or do this thing. So they try to like have in faith on those things more than actually screening or actually doing a vaccination. So what would you say to those people? I mean, like there's a lot of naysayers, I think, yeah, in general, despite being in like one of the most like advanced medical facilities in the world here, but we see a lot of people, like you notice that they don't get diagnosed early on time and they face the consequences later, which are much more dire.
Yeah. So we have seen a lot of vaccine naysayers during our COVID times, and vaccine naysayers are there in each and every state. And I think it is from conservative side to the other side, both sides have vaccine naysayers. And I think those individuals probably will have their own belief. But what I would suggest that always follow the evidence-based healthcare. So if the Journal of Internal Medicine or Family Practice or anything which has research on thousands and thousands of individuals, and if that article is published, believe that. Don't believe in naysayers or anything which is not scientifically not proved. So that's my message to the community, that if you have any doubts, talk to your primary care provider. Talk to someone who has a knowledge of medicine. Always follow the evidence base. So I think if you, and I am nothing against the alternative medicine. Alternative medicine is good. It works in some cases. But once you have a diabetes or once you have a cardiovascular disease, you cannot wait. You have to go see your doctor. If you have a heart attack, you have to go to the emergency room. If you have a stroke, you can't wait. You have to get that injection as quickly as possible to reverse that stroke problem. So I think those are the basic fundamental things people need to understand, that if you have a diabetes which is controlled by Ayurveda or homeopathy medicine or alternative medicine, go for it. It's okay. If it's okay to continue with that. But once it's not controlled, you have to manage that with your physician.
So, doctor, I mean, that's such an important note. I think at the end, you just collected the message you gave is such an important message that I think it will save literally thousands and thousands of lives. Because I actually volunteer in the hospital and I noticed that definitely early detection and taking care of things at the early stage, and your belief is okay, but the belief should not hurt you, right? You have to believe at the end of the day in the science. And that is such an important and very important message. So I'm sure we could go on and I think go more detail. But since this is the time we have, I would like to encourage all the audiences all around the US and especially in like all the metro areas where there's a lot of Indian diaspora, Indian community, which definitely need such programs. So I would highly encourage them to get motivated, galvanized in their communities. And there's no excuse now because you don't have to have any background also. And Dr. Tushar is there to help and navigate the waters and all the logistical issues. So I would highly encourage all the audience to kind of reach out to him and start these programs all over the US. And we're such a blessed to have you as a doctor and galvanized and doing so much to help bring the affordable healthcare to community. Such a important role you're playing. That's so amazing. And this is regardless of any religion, sex, or any specific geographical area. Even though we talked about Southeast Asian or Indian, but this is open to all people, all over the, like, anybody can come there.
This is open to all, and I think I'm going to add one more thing in there, that if anybody is visiting from India and if they have nothing here, we will take care of those individuals as well, because the human being is human being. Government makes the rules of many things and we have to follow that, but as a mankind, as an organization, we want to help each and every human being, and I think we are ready to take the challenge. And one last thing I want to add also in this, that the yoga and meditation are the biggest part of our health. So if you take some time to meditate yourself or do yoga, definitely that will increase your life expectancy, your mental health. And at certain point in life, the medical or the regular diabetes, hypertension, you can treat with medicine, but your mental health has to be owned by yourself. And if you cannot do it, it's going to be a problem for you. So I think use those alternative holistic approach as well.
That's so wonderful idea. I think basically we don't have to leave one thing and just this don't like a zero sum game. I mean, we can be following the alternative and Ayurveda and yoga and meditation. Those are amazing tools we have, but there's no need to ignore this tool, the preventive and vaccination.
When there is a need. Yes.
When there is a need.
Yes.
So, I mean, Doctor, I think we have very few minutes, just few seconds left. Would you want to just give the your organization's the website address so audience can reach out if they need?
Yes. So Health Camp of New Jersey is at www.ihcnj.org. My email address is president@ihcnj.org. My cell phone number is 848-391-0499. And I am so thankful to Radio Sabarmati, Kiranji and Tarunji for your time in promoting this wonderful initiative we are doing. And I think definitely this will help other states as well to learn and open a next community health center where I can go and help them.
Thank you so much, Dr. Tushar. It's such a wonderful, it was joy to talk to you and get to know the selfless service you're doing and helping the community. Congratulations on your this endeavor and initiating this, and wish you all the best and good luck, and hopefully a lot of people will follow this. And I'm certainly feeling very jealous of New Jersey. People visiting New Jersey, they definitely can have a fallback mechanism. I think they know where to reach. I think they need any help. Thank you so much.
Thank you so much.
Yeah.
साबरमती ना खड़खड़ वहता पाणी ना दुननी साते अमदावादियों ने मड़ी नवी धुन रेडियो साबरमती आधुनमा मिल जाए खुश रहो आबाद रहो आज एक गुंज छे हमारी तमारी साबरमती 89.6 छे साबरमती 89.6 છે એકદમ ફિક્સ છે ધૂનમાં વાળ મિક્સ છે સ્માઇલી પિક્સ છે સોલ્યુશન ના ટ્રિક્સ છે ખુશીઓની ફિક્સ છે જીવન જીવવાની સર્વશ્રેષ્ઠ ટિપ્સ છે સાબરમતી 89.6 છે સાબરમતી